Now, before I talk about the neurological brain-based exam that we do in the office, what I'd like to do is cover one more point about treatment. Now, parents are always asking me, are there any medications or drugs involved? Absolutely not. We do not prescribe, and it's not our job to put your child on any medication or to get your child off of medication. And if they're already taking medication when they come in, they can certainly still do the brain-based program while they're on the medication. They do great while they're on the medication, and the program is just as effective. But the ultimate goal is to get your child to need less or need no medication at all, because most parents really don't want their kids on the medication because they understand what the side effects are. So we can do that too. In fact, most of the kids that come in that are on the medication get off of the medication. So we don't use any medications, and that's good because there's no withdrawals, there's no side effects, and the program is relatively simple. Basically what we're going to do is we're going to analyze your child's nervous system, and we're going to look for any weak areas. We call it a functional brain assessment. And it's going to start off with a 7-page questionnaire that's going to be incredibly detailed, going over your child's history. And we're going to ask a lot of questions in there that's going to help us understand exactly why your child's having the problem. Then your child comes in and they get the functional brain assessment. And in that functional brain assessment, again, we're going to analyze your child's nervous system. We're going to look at auditory reflexes. We're going to look at visual reflexes. We're going to look at their muscle tone. We're going to look at their posture. We're going to look at the health of their spine. We're going to do some very extensive cerebellar testing. Because remember, kids with ADHD, their cerebellum a lot of time is not functioning well. We're going to look at their gait, we're going to look at their balance, and then we're going to put them on what's called the interactive metronome, as we talked about before. And the interactive metronome is not only a treatment, but it can be used diagnostically. So we're going to do what's called short and long form testing on the interactive metronome. So basically the whole goal is to determine which side of your child's brain is not functioning well, and also what areas on that side are not functioning well. Again, it's called a functional brain assessment, and the goal is to find out what's causing your child's problems. Now, the other thing that we do is something that's called video nystagmoscopy. And basically what video nystagmoscopy is we use these goggles, and we put these goggles on, and in these goggles, in this area right here, there is an infrared camera. And what the infrared camera does is it videotapes your child's eye movements. Now, most people have heard that the eyes are the window to the soul. Well, that's true, but the eyes are also the window of the nervous system, so they're incredibly diagnostic, and it's a real good window into how the nervous system is functioning. So we're going to look at lots of different eye movements in here using this. We'll put these goggles on, and it's going to let us know where some of the problems are in your child's brain. So this is something that we do, very important. So basically, what the exam is going to let us know is what side of the brain is weak, what areas need to be strengthened, and then based on that, we develop a treatment plan for those problems. Now, the treatment plan. Brain-based therapy is done here in the office 2 to 3 times a week for the first 90 days with parent follow-through, meaning the parents are going to be involved in the in-office sessions. And then we have homework. Homework is incredibly essential, and the parents will be involved in that also. Because the brain learns through repetition, and the repetition of doing the things that we do, the different treatments, are what's going to make the change. So in-office sessions for 90 days and homework is going to be very important. The biggest indicator in whether a child does well with our program is how well the parents follow through and follow the instructions that we give. How well do they do the homework at home? How well do they make any metabolic or nutritional changes? So we have the in-office sessions. We have the home therapy. Then we have the goals. We have the outcome assessments. We have the re-exams, because we want to make sure that your child's improving. We want to make sure that they're getting better. Now, one of the big questions that we always get from parents is, how long does it take, and do the results last? Well, it doesn't take very long to start seeing some positive results right from the get-go. However, depending upon the severity of the problem, how bad the focus problems is, how bad the ADHD is, it may take anywhere from 3 to 6 months of repetitive treatment to get that child to function better. And that's going to depend upon, again, how severe the problem is. The other question we get is, do they need to do it forever? And the answer to that is no, because the goal with this program is to actually change the brain, to develop what's called healthy neuroplasticity, which means that there's better, healthier pathways in the side that was weak. However, some kids may need some maintenance, and the maintenance is less intensive. Maintenance may be defined as making sure that your child's following through with some of the nutritional recommendations we have. It may also be defined as some home exercises. So we want to teach you how to take care of your child better at home. The other thing that they may need is some, again, maintenance care may be defined also as coming in periodically to have a treatment here in the office. That's going to depend, again, on your treatment goals and also how severe the problem is with the child. So basically, the reason why we have such great results with brain-based therapy is, number one, we look at everything. We're going to look at your child's neurology. We're going to look at them metabolically. Our treatment approach is a non-drug approach. We're going to use things like interactive metronome and specific stimulations. And the other thing is our treatment philosophy. Our treatment philosophy is treat the child, not the diagnosis, and that's incredibly important. So watch some of the testimonials. After I'm done speaking here, there's going to be even more testimonials that you can watch on this video. So get great results. So if you have a child, or you know somebody that has a child that's suffering with these types of problems, taking medication, or you've had parents that are struggling, looking for some answers, but basically all they're given is more and more medications, we would recommend that you would have that child come in, or that teenager, or that adult for that matter, come in and get a brain-based functional assessment. So we can determine where the problems are. So your child can get back to the mainstream. They can start feeling confident about themselves. They can get back to focusing in school, getting the kind of grades that they need. So eventually in their future they can potentially go to a college if that's something that they're looking forward to doing. So we get great results. Watch the testimonials on the video. If you want to have a functional brain assessment, give us a call at 610-518-3370. And this is Dr. Joseph Childs. Thanks for listening.